So today we are going to discuss about the femur bone. Femur bone has three parts: the upper end, the lower end, and this is known as the shaft of the femur. So first of all, we'll discuss about the upper end of the femur. Upper end of the femur. In this upper end, there is a rounded structure. This is known as the head of the femur. In this head of the femur, there is a depression known as the fovea. There are presence of two trochanters. Trochanters are just prominences. This is the greater trochanter, and this is the lesser trochanter. Greater trochanter. This is the lesser trochanter. Between the two trochanters, there is an intertrochanteric line. Intertrochanteric line. And this area, this is known as the neck of the femur. So let's move to the posterior view of the femur. This is the head of the femur. This is the neck of the femur. There is a central fovea. This is the greater trochanter. This is the lesser trochanter. And the intertrochanteric line that we discussed in the anterior view of the femur is present in the form of a crest in the posterior view. And this is known as intertrochanteric crest. It is more prominent than the anterior view. Intertrochanteric crest. So now, this one is the upper end of the femur. Now let's discuss the shaft. This one's the shaft, right? So in the shaft, let us divide the shaft into three parts: the upper 1/3, the lower 1/3, and the middle 1/3. The upper 1/3 has 4 borders and 4 surfaces. Upper 1/3. Upper 1/3 has 4 borders and 4 surfaces. See, this is one border, this is another border, this is another border, and this is another border. This is the upper 1/3. Then we have middle 1/3. Middle 1/3 of the femur bone has 3 borders and 3 surfaces. See, This one is one border, this one another border, and this one is another border. Okay, so middle 1/3. And lastly, this is the lower 1/3 of the shaft. Lower 1/3. This lower 1/3 has again 4 surfaces and 4 borders. See, this one is one border, this one another border, this one border, and this another border. Okay, now let's discuss the borders and surfaces of the upper 1/3 of the femur bone. See, this one is the medial border. And how we can know that it is the middle border? The head of the femur faces medially, and the border which is along the head of the femur is the medial border, and this one is the lateral border. Posteriorly, see, this one this one is the lateral lip of linea aspera. This is the lateral lip of linea aspera. And what is linea aspera? This line you can see here, no? This one, this line is known as linea aspera. Okay, this is linea aspera, and this one is the lateral lip of linea aspera, and this is the medial lip of linea aspera. And another border which forms the another remaining border of the upper 1/3 of the femur is the spiral line. Okay, this is the spiral line. So now the surfaces. What are the surfaces? Between the medial and the lateral borders, there is the anterior surface. Here we have the medial surface. Here we have the lateral surface, and in between this, it is the posterior surface. And this posterior surface has a rough area known as the gluteal tuberosity. Okay, now let's come to the middle 1/3. It has an anterior border, it has a medial border, a lateral border, and a posterior border which is formed by the linea aspera. This is the posterior border. And let's come to the surfaces. This is the anterior surface. Then we have medial surface, and we have lateral surface. or more specifically you can say that it is posteromedial surface and this is posterolateral surface. Okay, now let's come to the lower 1/3 of the shaft. Again, medial border, lateral border, and these are the supracondylar lines. Okay, see, these are two condyles, medial and lateral condyles. Okay, and these are just above the condyles, so these are known as the supracondylar lines. So this is the medial supracondylar line, medial supracondylar line, and this is the lateral supracondylar line. So this forms the another remaining two borders of the lower 1/3 end of the femur shaft. Okay. The femur is also known as the thigh bone. So what are the surfaces of the lower 1/3? This is the anterior surface. And then we have the medial and the lateral surface. And this one, this is known as the popliteal surface. Popliteal surface. Okay, so now let's discuss the lower end of the femur. Okay, and this is the lower end of the femur. This was the shaft, okay, shaft of the femur, and this is the lower end. In the lower end, there are presence of two condyles, okay, and these condyles are more prominent and more visible in the posterior view. This is the medial condyle and this is the lateral condyle. And there is a fossa in between the two condyles. This is known as intercondylar fossa. Intercondylar fossa. Okay. And see, just above the condyles, there are two ridges. These are known as supracondylar ridges. This is the lateral supracondylar ridge. Lateral supracondylar ridge, and this is the medial supracondylar ridge. Okay, here also we can see the ridges, but see, the condyles are not that much visible. Rather, there is an articular facet for the patella bone. Articular facet for patella bone. Okay, so we are done with the bony features of the femur bone. Now we'll look into the muscle attachments. I hope you understood. So let's look into the muscle attachments of the femur. Anteriorly, in the upper end of the femur, there are attachments of the piriformis muscle, I'm telling you again, you don't have to remember the muscle attachments right now. You'll get to know it when you study the individual muscles. So don't be tensed. This one for the gluteus minimus, vastus lateralis, vastus medialis, and this one for the vastus intermedialis. These two dots for the articularis genu muscle. And this one for the adductor magnus. Oh, I forgot one more bony feature. There is a tubercle present here in the medial epicondyle. This is known as the adductor tubercle. Adductor tubercle. It is present medially. Okay. See this one. This one is the adductor tubercle. Again, posteriorly, the greater trochanter gives the attachments for the gluteus medius muscle. This one for psoas major, iliacus, and this one for pectineus. You'll know about these muscles when you read the femoral triangle. This one for the gluteus maximus muscle. Vastus lateralis, vastus medialis, and in between we have the adductor group of muscles. Adductor, we have adductor longus, adductor brevis, and adductor magnus. In the lower end, we have this medial head of gastrocnemius muscle, medial head of gastrocnemius, and this is the lateral head of gastrocnemius. Okay, you are almost done with the femur bone, so I'll now discuss about the site determination and the anatomical position. How will you determine the site of the femur? So this one should face, this is the head of the femur, which should face medially, and the intertrochanteric line, not the crest. I'm not talking about the more prominent one. I'm talking about the intertrochanteric line, which is less prominent than the intertrochanteric crest. It should face anteriorly. Then the lower end should be horizontal. This surface of the lower end, the articular surface of the lower end, should be horizontal. The shaft should be oblique face oblique medially, okay, and the medial epicondyle will be larger than the lateral epicondyle. The adductor tubercle should face medially. Okay, these are the features by which you can determine the side and the anatomical position of the femur bone. I hope you understood what I explained. So thank you for being with me. Bye bye.